Times Influence Initiative.
The Digital India Summit and Awards 2017, hosted annually by the Times Network and now in its third edition, has become a thought leadership platform on powering the country's digital economy. And the Digital India Hero Series is an attempt to highlight the award-winning, groundbreaking digital initiatives that are transforming India's corporate and socio-economic landscapes alike. Welcome to the Digital India Summit Winner Series, tying tradition with technology to make medical records wearable across rural India is young social enterprise Khushi Baby. We visited their headquarters ourselves to understand how. With a near-field communication necklace that stores medical records for mothers and children alike, Khushi Baby is quickly closing in on the country's immunization quandary. With its fully integrated data-driven end-to-end solution, here's a company that makes a clear case for how a digital spin can make for a medical win. Let's start off with some statistics. How many babies die in our country each year from vaccine-preventable diseases?
In India, it's estimated that 500,000 children under the age of 5 die from vaccine-preventable disease every year. Of course, this is only an estimate. We don't actually know. And that also is part of the problem. It's an unacceptably high number, 500,000, but we also don't know which specific kids are not receiving the vaccines that they need in the first year of life. So the statistic is a problem, and the fact that we don't have the statistics is also the problem.
So what's Khushi Baby's approach to bridging this immunization gap?
So we have vaccinations, which we just discussed. But really, vaccinations and infant care falls in a spectrum. It's our goal to ensure that along this spectrum, we empower both the patients as well as the health providers to get the best services and to make the best decisions about those services. We want to make sure that each patient has a durable and reliable copy of their own medical record. In this case, it's something that they can wear and something that means something to them. For the health worker who's going into the villages at the front line, we want her to be empowered with digital technology that allows her to be confident in the decisions that she's making. And finally, we have the health official. The health official right now is looking at aggregated data. And as we mentioned before, this data is not really a reliable indicator of what's happening at the field, especially at the last mile. So it's our goal to provide that health official with reliable data, with timely data, but most importantly with data that can be used for decision making. So we've designed the whole dashboard to ensure that we have smart lists. With one click, you can see which nurses are facing which shortages of which vaccines, or which nurses cannot perform the hemoglobin test because they didn't have the hemoglobin equipment functional. With one click, you can see which mothers are due for delivery in the next week. These are the kinds of report formats, along with many others, that we've made in order for various different stakeholders on the management side to take direct actions on a week-to-week basis.
Well, this solution is intended for the most marginalized of communities. How does the design reflect their limited exposure to technology?
Design is really core to what we're doing here. In many cases, someone can build a technology and hand off a technology without really understanding the end user's needs, and what ends up happening is that technology stays on the shelf. For us, we are looking at the end-to-end solution, iterating upon our designs, then actually deploying that technology. So how do you train these nurses? How do you communicate with these families? Monitoring and evaluating is also the last and key component for our whole end-to-end solution. So we're actually involved in all aspects of this in order to ensure that the technology is so-called appropriate. Now specifically, when we came here in 2014, we had an idea that we wanted to have some kind of wearable medical record. And we were debating, should the child wear it, should the mother wear it? And through this process, we actually came into contact with the local jewelry. We learned a little bit about the local customs. And something very important came out from these discussions. And that insight was that the children are already wearing black thread, black necklaces, kala dhaga, which has a symbolic meaning of protecting the child from evil eye or buri nazar. And we saw this as a great opportunity for us to slot into something that's not only culturally acceptable, but culturally symbolic. This wearable necklace is something that we've seen in the field from our trials. It's something that is much better retained than the paper card that the government gives out. Up to 5 times more retention when you get to 6 months of the baby's life. That's important because for the same issue, when the patient comes to the health worker doesn't have the record, then how is the health worker supposed to take the specific action that this baby needs? And this form factor, by the fact that it is better adopted and better retained, allows for that interface to be maintained. That's the first part. We started off with designing an interface that can read and update a child's immunization record. And after talking with government officials, we quickly realized that the government is actually tracking things that are beyond immunization. It's tracking the entire scope of maternal and child health. So we looked at the National Health Mission guidelines, and we looked at each and every one of those columns that they're tracking. And we had to figure out a way to put these 150 columns of the register into a tablet-based app. But that was just one part of the challenge. We also had to figure out, okay, we have all this data that we have to collect. How are we going to put this in an intuitive form that any nurse can use? We are happy to say that we've been able to make something that really does integrate into their workflow. And one of the key components of their workflow is that they work in a place that's completely offline. They're working in the last mile, the most remote regions, where you may not even have the ability to send an SMS. So our platform needs to be robust enough to work in those scenarios. And there are several ways that we achieve this. So we've designed the platform to be completely connectivity independent. So as a nurse, if I see a patient, I can scan their necklace, I can get their medical record, I can verify the patient, I can give the patient the medications they need today, and I can save their medical record. And next month, they can go to the next nurse, they can go to the PHC, they can go to the district health hospital, and that linkage of data remains preserved.
For any public health initiative to gain mass adoption, partnering with the right organizations and building an ecosystem around the solution itself is critical. What steps have you taken in that direction?
Yeah, so public health is nothing without partnership. And for us, we are very lucky to have a village of partners who are coming to support us. We started off as a university project, so our first partner was Yale University, and soon after the Indian Institute of Health Management Research in Jaipur. The support of institutions like UNICEF, Gavi, Bill and Melinda Gates, from the health and policy standpoint. From the research standpoint, we've had the support of organizations like 3IE, the International Initiative for Impact Evaluation. Besides those partners, we are also very lucky to have the support of technology partners. So we are working with Safran. Safran is a large multinational technology company, and we are working with their identity and security department. Software development, we also have partnerships. So Mobisoft Infotech out of Pune, we've been working with them for the past 8 months now, and we're very lucky to have them and the engineering support that they provide. Beyond those institutions and partners, the biggest partner for us, of course, is the local support that we have here with the Udaipur district government. And their support is crucial because ultimately it's the district government under the National Health Mission umbrella that is implementing all of these services.
What are some of the challenges you faced in scaling the Khushi Baby system? And once you achieve that scale, what's next?
Scale for us starts with working with the government. There are over 2.5 lakh A&M nurses or frontline nurses who are going and taking care of maternal and child health related issues. and they take care of about 25 million newborns every year. So these are our users that we hope to scale. We want each one of these nurses to have a tablet that's running the Khushi Baby platform, and on the order of around 20 to 50,000 district health officials at different levels who are using our dashboard. That's the broader vision.
There's a multidisciplinary team in place here of just 25. What are the drivers? What brings them here? What motivates them every day?
Their prime motivation is they want to do something that's different, and they want to do something that can make an impact. And they're willing to take a risk to see that change and be a part of that change. The kind of people that are joining our team are people that can wear different hats, who can, adapt. So I think that's part of the energy that is really unique about our team. Really, it's this interdisciplinary mix of ideas which makes a project like this possible, because it really does touch on all these different aspects. It touches on design, from what kind of jewelry is the mother wearing to what does the app look like. Of course, really what puts it all together and what cements it is when you go to the field and once you experience this solution actually coming together. Once you've put in all the hard work, all the late nights, all the weekends, and you've worked tirelessly to build this application, and we see babies coming back wearing the necklace. We see incredible stories of mothers who have to cross rivers, or even mothers who are blind who are coming to these kinds of health camps. And to think that now, when they show up to this health camp after going through all this effort, we can at least ensure that they have the right record and they'll be receiving the right treatment on that day. That's an incredibly rewarding feeling.
With its socially symbolic necklace, robust mobile app, and cloud-based dashboard, Khushi Baby is rapidly redefining how vaccination data is captured and deconstructed. By unlocking a child's vaccination history with the simple scan of a computerized chip, Khushi Baby is empowering health workers with access to an infant's immunization records where it matters the most, at point of care. It's time for a short break, but up next, our Digital India Summit Winner Series continues. Don't go anywhere. Welcome back to the Digital India Summit Winner Series. Our next company is revolutionizing rural education by going digital, but differently. Here's a glimpse of our conversation with CLT India. CLT India is credited with bringing low-cost yet highly customized content to village classrooms. With its SIM-enabled Android-powered device and plug-and-play form factor, the CLT ePathshala platform has found favor in even the most infrastructure-deprived environments. Giving students and teachers alike greater access to curated curriculum, CLT India is a technology intervention play that's taking on rural education one chalkboard at a time. You've been an entrepreneur in the education space for over 2 decades. Walk us through some of the ground realities when it comes to becoming a more literate India. Where do things stand?
About 20 years back, when we entered this space, one of the things that actually struck me was how the children still had the aspiration to come to school, and parents wanted to send them to school, but the schools themselves had nothing to offer to them. Starting with a simple, like a lunch program. Neither the parents were able to afford to send lunch to the school, nor the government was able to provide a midday meal. So our starting point was that, setting up these lunch programs for the schools. And that's where the name of the organization, Love Castles, also started, because I was connected to a group of daily wage earners children who would make their way to the school, and I would follow them to the school, and then I would literally see them building these castles out of sand and mud. But then I would realize that there is a lot of gap between their aspirations to build their own homes as such to what is actually possible for them, the missed opportunities.
There's several digital initiatives in place designed to help enhance rural education in this country. So what makes ePathshala different?
So although we started with one simple program like that, it gave us a close look at the realities of these state-run schools, whether it's urban or rural, but rural schools had more challenges. That problem hasn't gone away even today, which is the severe shortage of teachers that our country needs. The conservative number is 1.2 million. That being so, how do we actually make the children learn in the same given environment? So that was a starting point for us to actually get into the education space itself from the nutrition space. While we were doing this program, we also realized, there were a lot of single teacher run schools or 2 teacher 5 grade schools, and a whole lot of models exist even today. The government itself, Sarva Shiksha Abhiyan and all of those, some of the initiatives are great, but they've only been able to arrest the nutrition problem through the midday meal program or doing out the textbook distribution. Some of these things they are able to do, or every child in school, some of those programs. But a recent report even by Acer as of last year, it shows as far as the learning outcome is concerned, there has been no impact at all. Or we put a lot of efforts into understanding the disconnect that was happening. Every teacher might know how to use a basic phone, but most of them do not have computers at home. None of them have computers in school. Most of them do not have internet connectivity to be able to do it. They do not have training as well. So if that being so, how do you actually connect a solution that's either cloud-based or a network of computers to be there? So there were a lot of external dependencies that the other programs had. So we realized if we have to give a solution, we had to provide a customized solution, a local solution, that when once we leave the teacher with the solution, they are able to manage it by themselves. And also we didn't want to run parallel structures from the beginning. Our premise has been, if the government has already made an effort and made an investment into a system, to put a system of education in place, just learning the gaps, what is it that we could provide with the other layer of network of support for these schools. So we never had the ambition to run our own schools, replace the local teachers, or come up with solutions that would actually hijack the local teachers, and the teachers will have no key role.
Walk us through the various components of ePathshala and what are they designed to achieve?
If you are a village teacher and enter a classroom, the only content that's available is the textbook content. So it was about coming up with the right kind of content and then making it locally available to the teacher. We had to come up with low-cost technology delivery models to be able to give access to the content in the teacher's own environment with the limited resources that was available. That's the second part that we put a lot of efforts into after trying many failed models and understanding and deconstructing about why some of these models went wrong.
How scalable is this model and what have been your biggest proof points?
So this is an unexplored space. To us, it's a great advantage because it's a wide open field for us. This is exactly where we want it to be. So, but unless we had a tracking mechanism of the usage of the content, we will not be able to scale this particular program. So from the beginning, our vision was clear that we wanted to come up with a scalable, replicable model. If the infrastructure model is appropriate, if the content is localized and mapped to the local curricula, the scaling can happen.
As you mentioned, for the solution to be successful, it needs to be low cost, it needs to be easily accessible, but then it also needs to not be daunting or overwhelm the end user. How is that philosophy reflected in your design?
We put a lot of efforts in Karnataka to actually understand the ground level realities and to be able to learn from it. In Karnataka, in the last 2 years when we have actually pretty much perfected this particular model, we have grown to 7,500 or more classrooms that are actually using a particular content. The content itself, we realized that people thought e-learning meant 3D graphics floating all over, which made it so expensive. Even a private school, if they wanted to replicate that model, it was cost prohibitive. So we sort of looked at how content rich in pedagogy could still be achieved with low cost methodology. This compact device where it can hold an entire curricula in an Android mini PC, as well as it's a SIM enabled device, so it can capture the data of usage from every single GPS location. Secondly, this device itself, like I said, it can get plugged to a television or a projector. It's also a tablet based solution. And then if there is no power, we encourage them to use a solar solution to drive these particular programs. Of course, it has to be in local languages. So we have done it in for Karnataka, we have done it in Kannada, where it's been already in 7,700 classrooms. And now we have moved to Rajasthan and UP and a couple of other states with the Hindi content. And then Maharashtra, it's getting launched end of the month.
What is your vision for the future and your growth strategy when it comes to CLT India?
What we've been able to learn from the impact studies that we've been doing with the experts is that we've been able to bridge these gaps. Like many children are 2 years behind where they ought to be. As you move to higher grades, they could be 4 grades behind, 5 grades behind. What we are able to do is with these resources at their fingertips in their own environment, we have been able to close those gaps. So under the umbrella of ePathshala, we have made sure that localized content that is mapped to the curricula in local languages is available. Second thing, under this umbrella, we have made sure that there is a low-cost technology delivery model that is available. We have been able to put together a partnership model that can be replicated in other states as well. And then the data analytics is the new thing that we have added that hasn't been available in the rural sector to the large masses, the volume that I'm speaking about. You might have boutique models, you might have brochure models, but not the scalable model. So we've been able to put together a total solution. We've been able to put together an ecosystem where this can actually thrive and grow. This is the differentiator for me.
So you left behind a successful, secure career in the US as a software developer to return to India and pursue social entrepreneurship. What's been the most rewarding aspect of this journey?
There's a shift in the way information is being exchanged between the teacher and the student. There's a shift in the way how it's brought a interactive, collaborative learning environment as opposed to a chalk and talk environment. So to me, it's a transformation that we are bringing into each learning environment, making it a more dynamic process as opposed to a textbook and a blackboard and a teacher that has no confidence to teach these particular subjects. The transformation in every single location, as remote as they are, us sitting in this city, we are able to influence how a village in Rajasthan might be actually getting transformed. To me, that's the motivation.
Today, the CLT India ePathshala, which is both richly multilingual and highly audiovisual, has made its way to over 7,000 classrooms across the country. With content that is modular, metrics-driven, and seamlessly intertwined with a powerful analytics engine, the enterprise is breaking new ground in making curriculum accessible and classrooms accountable. Next week on Digital India Heroes, we feature another set of winners from the Digital India Summit and Awards 2017. A healthcare provider that's modernizing medical oncology, Manipal Hospitals. And Amba, a social enterprise that's economically empowering intellectually disabled adults. Stay tuned.
Times Influence Initiative.